Thank you very much for that kind introduction. I'll tell you, this is the first time I've ever had the opportunity to hear Amjad speak about artificial intelligence, and I will say that as much as I've read about it, it has never been more crystallized in my mind about exactly what it is, where we've been, and where we're going. That was a spectacular presentation, Amjad. So I want to thank you for the invitation to be here, and thank you for expanding my horizons in terms of artificial intelligence. I want to thank all of you for being here. Many of you don't know I was actually born in Jordan 50 years ago, and this is an absolutely beautiful country, and I'm just so honored to be back and participating in this conference. So, you know, great technologies and great advancements frequently come about in times of crisis. And I would argue that today, globally, we genuinely have a healthcare crisis. Let me just ask in the audience here, how many people in the audience know of somebody somewhere around the world that needs healthcare but is unable to get high-quality, low-cost healthcare? If you know it, somebody, raise your hand. Essentially, every person in the audience has their hand up. That's the crisis that we have. If you believe that every human being should have access to high-quality, low-cost healthcare, that is an opportunity for us. Next slide, please. This crisis is based on many things. It's based on an inequality of resource spread across the world. It's based on a lack of true knowledge driving healthcare decisions. It's based on many people still having the sense that healthcare is both an art and a science. The reality of it is medicine should be a science, not an art. It should be making sure that patients have access to the highest quality, most proven healthcare options at all times, and not experimentation with what somebody may have learned 10, 20, or 30 years ago and has not kept up with the data. That's really the opportunity. Next slide, please. If you look here in terms of our global healthcare risk, you can see how much of the world truly is at high risk because of a lack of basic or even moderate healthcare needs. 1 in 10 patients around the world are harmed during medical treatment. 10% of patients that come into the hospital globally have a hospital-acquired infection. And only about half the time when healthcare is it provided following clinical guidelines. This is a crisis. This is a crisis that in no other area would we allow it to happen. Next slide, please. If you look at the global physician density around the world, you can see that we have parts of the world that are very highly populated with physicians and other parts of the world that have very few physicians. So that whole idea of access to high-quality care, just from the perspective of human beings providing the care, is limited. And I don't think we're going to solve that problem by training more and more doctors. The training of a physician, training of healthcare professionals is extremely expensive. This is the type of area where we start looking more for transformative digital platforms to help change the way we deliver healthcare. Truly an opportunity to disrupt ourselves in terms of the delivery of healthcare. Next slide, please. Same thing with hospital beds around the world. So we have some countries that are extremely highly densely populated with hospital beds and others that have very few. And I would suggest to you that simply having a high density of hospital beds is not necessarily a sign that your healthcare is any better than anybody else's. Around the world, what we're trying to do is to try to transfer more and more of the care of patients outside of hospitals and into their homes. If we can do that, we can actually provide, in many cases, higher quality care at a lower cost. And this is a huge opportunity for us globally. Next slide, please. Finally, Amjad touched on this earlier. How much we spend on healthcare is a very real challenge. And in the United States today, we are spending close to $4 trillion on the delivery of healthcare every day. Now, what does that mean? When you spend that much of your gross domestic product on healthcare, it means that you cannot spend that money on education. You cannot spend that money on hunger. You cannot spend that money on homelessness. That is a real challenge. So we in the United States are trying harder and harder to understand how we can do a better job of shifting our resources to a healthier society where we are disrupting the way we deliver the healthcare so that we can take those resources and spend them on things like education and social services. And that will take us time. Next slide, please. Just some basic global statistics here that are really quite sobering. 50% of the world is unable to access basic healthcare today. We have a projected global shortage of almost 13 million people by the year 2035. 5 billion people lack access to safe, affordable surgical and anesthesia care. Over 100,000 physicians short in the United States alone by 2030. And look at that number of healthcare spending, estimated to go from about $8 trillion a year, half of which is in the United States, to $18 trillion a year by the year 2040. So if you're looking for an area that is ripe for disruption, where artificial intelligence can help reset what we do, this is a great area. This is a huge opportunity for us around the world. Next slide, please. So the areas that I'm just going to touch on here through this presentation really fall into three categories: big data analysis, clinical decision support, and remote patient monitoring. And the reason I'm going to touch on these is every one of these helps us solve the basic value problem in healthcare, which I'll go into here in more detail. Next slide. In terms of clinical decision support, Amjad touched on this just briefly when he talked about how much data there is in the world today. It's amazing when you realize that in healthcare alone, that medical data doubles every 73 days. So no matter how good your doctor is, there is no way they can keep up with that piece of information. You need access to advanced computing to be able to figure out what the best treatment modalities are around the world for different problems and for different locations. There is no single human being, no matter how specialized that they are, that can keep up with this explosion of medical data. Number two, the whole idea of being able to provide healthcare without bricks and mortar and at different times, so asynchronous visits and telepresence will help reshape the way we develop healthcare. Again, given the fact that we recognize that 50% of the world today does not have access to high-quality care, we know that we're not going to deliver the bricks and mortar and human capital around the world to deliver that in the next 20 years. So we need new ways of delivering that care. So augmented virtual reality, telepresence, and asynchronous visits will play a huge role in that. And finally, the growing physician and nursing shortage around the world has to be managed by new cutting-edge technologies. Next slide, please. This is the healthcare environment that we're in today, and it's truly an inflection point for us, not only in the United States, but around the world. And that is looking today at insurance reform, at the demographics of our patients who are getting older every day, new digitalization that's occurring, healthcare policy, science, which is exploding around us, transparency of data, and consumerism. Our own patients becoming consumers and looking for the best, most cutting-edge treatments to healthcare. Next slide, please. Can you guys advance? This transformation, I think, has allowed us now to have a platform by which we will advance our science, by which we will advance the ability to deliver the care around the globe in a much more streamlined fashion with better outcomes that are based on science and based on data. Next slide, please. So what is True North? So in the United States, when we talk about True North, it's what are the things that we know if we deliver on these things, we will not be going wrong? The clear, right answers no matter what. Next slide, please. True North is really to deliver on this promise of value. And when I think about value, I think about a lot of the work that Michael Porter, who's at Harvard Business School, has talked about. He's talked about quality and cost. I would add to quality and cost access. Again, making sure that we provide the highest quality with the best access for the lowest cost. Next slide. This is what that equation ends up looking at. Advance, please. So it's the quality plus access and divide that by cost. That gives you the true value equation. And again, when we think around the globe, that's the opportunity that we have, is to provide access to every human being that needs it with high quality, proven care at the lowest cost possible. Next slide. Utilizing that value equation, everybody wins. There's really no losers in this world, right? The patients win because they have access to the highest quality, lowest cost care. Providers win because we want to be working at the top of our licensure. As a doctor, I'm an orthopedic surgeon that does hip and knee replacements. I don't necessarily want to go to my clinic and see a clinic where everybody says, well, I bumped my knee. I want to go to the operating room and operate all day. That's the best use of my time. And that's candidly the best use of society's money for me to be doing that as opposed to being in an outpatient clinic treating bumps and bruises. So that whole idea from a provider perspective also provides our providers with the opportunity to operate at their top of licensure. From a payer perspective, they get the biggest bang for their dollar. So as a payer, if I'm getting more for every dollar that I spend, that's a benefit to me. Suppliers, they can start aligning costs with outcomes. If you have a technology that works better, then by all means, we should consider paying more for it. And finally, the biggest winner of all is society, where we have a society that is based on doing the right thing for every patient every single time when it comes to providing health care. Next slide, please. So what are some of these technological advancements today? So over the last decade, and I would say even more than the last decade, probably over the last century, we have really concentrated on medical products, new knee replacements, new heart valves, heart-lung machines. These are the types of things that people have celebrated and have really given us the platform by which we work today. Today, we're working more on medical platforms. Your iWatch that you're wearing that's tracking how many steps you walked, having access to an Internet of Things enabled EKG machine, which sends your tracings directly to your doctor's office, and you get a phone call that says you need to take more of your medication or you can decrease your medication, right? But eventually, these platforms even are not enough. The next decade is the decade here that we start seeing true medical platform solutions, including robotics, AI, and augmented reality, the true transformation of healthcare that will allow us as a community to better take care of each other for the next decades. Next slide, please. So we are starting more and more to depend on our patients to play a more active role in their healthcare. And you can just get an idea of what some of these things, transparency of data, wearables, holding patients more accountable to making sure that they're taking advantage of information that guides them into better lives. And enabling this simple idea, which is the last bullet point here, of enabling care everywhere, anywhere, and anytime. That is really the crux of what we want to do, and we want that care to be well proven and inexpensive. Next slide, please. So let's look at how we can unlock new possibilities. Next slide. Do you have the volume? Can you turn the volume up for this video, please? So last year, I had the pleasure of having Amjad join me at the Cleveland Clinic Innovation Summit. This summit brings thousands of people around the world and talks about the most cutting-edge changes in healthcare and most cutting-edge technologies that are coming. And Amjad spoke about Beyond Limits and spoke about artificial intelligence. So that was just in 2018. And this year, in 2019, that was actually found to be the #2 best advance in healthcare around the globe. So this is really, I think, very exciting in terms of where we're going and the work that we're doing. You can go ahead and advance to the next slide. That was just announced last week, Amjad, that it was in the top 10 for 2019. You can go ahead and advance the video. So I'm not going to repeat this. You heard from AJ, really this pyramid of artificial intelligence. And again, what I think is so exciting about cognitive reasoning is that it takes the foundation of machine learning and deep learning, the idea of the computer kind of looking for patterns, and introduces the whole idea of cognitive reasoning, the human brain. And when you think about that, we as a human species have had tens of thousands of years to evolve our thinking process. The idea of having a machine that can do what we do by itself is impossible to fathom. But when you include in it the idea of cognitive reasoning, where the machine can teach itself and draw conclusions and extend thinking out of the box, like what Amjad said, that is really the key to taking us from where we are today, things like natural language processing and looking for patterns, and taking it to the level of a true thinking machine. Now, when you think about the fact that we have such a shortage of healthcare providers, that machine can then become your healthcare provider as long as it is well managed by a human being that understands the gold standard. That's the key that we'll be looking for. Next slide, please. So this whole idea of big data analysis makes a lot of sense for us. It's taking massive amounts of patient data. Do you know how big the average medical chart is for a patient in the United States whose records are in the electronic medical record? 830 pages for an average patient. Who's going to read 830 pages every time the doctor walks in the office? You're not. It's not even possible to do. So the idea of utilizing augmented intelligence, artificial intelligence, to help go through these massive amounts of data and extract from them the actionable pieces of information that we need to act on is an enormous opportunity. Today, in that electronic medical record, 80% of the data is invisible because it is not structured. It is not, you can't pull it out individually and utilize that information to run predictive models. It has to be utilized differently. So that's one of the things that we're working on today in healthcare. Next slide, please. This is Google's Apogee platform. The idea here of enabling, augmenting, and extending the functionality of the electronic medical record. So going into the data, extracting the data, looking for those patterns, making suggestions. This is reality today. It's not widespread. It is only now starting to be used at very select centers. But that idea, that very beginning of an artificial intelligence platform to help build on data and make it actionable, intelligent information, that is the key that will allow us as healthcare providers to be better at what we do. Next slide, please. And the goal is simple: reducing risks during care transitions, delivering patient-centered digital services, and improving care management. Very simple goals. That's the beauty of healthcare, is we don't have to be complex with what we want to deliver. What we want to deliver is very simple. It's making people better for lower cost. That's a nice, simple way to think about it. Next slide. So when we start thinking more and more now about increasing access, recognizing the fact that there are not going to be enough of us that are delivering healthcare around the globe to be able to touch every patient, this becomes the idea of things like telepresence. So imagine a scenario where we're all sitting in a room together, thousands of us, and there is a hologram of a doctor giving a lecture on diabetes, right? Or even better, imagine a scenario where we're all sitting in a room and a whale comes swimming out of the ocean and lands right in front of us. Next slide, please, if you can play the video. This is the type of work that's being done now in Florida with a company called Magic Leap. This idea of augmented reality and telepresence, where you can be on the other side of the world, but from the perspective of the person on the other side of the world, you are right in front of them. There's no delay, conversations occur back and forth, and it's absolutely amazing. And this technology is there, it's active, and it's now being looked at for how we can apply it to deliver world-class healthcare around the globe. Next slide, please. This is how we teach anatomy at the Cleveland Clinic Lerner School of Medicine. So anybody in the room that has gone to medical school in the past has used a cadaver, a human cadaver where we've dissected that cadaver, and we've looked at all the nerves and the veins and the various structures. Today, our medical school utilizes a HoloLens. All of our students wear them, and they see essentially an artificial human in front of them. They can go through every part of the dissection utilizing their HoloLens without ever touching a cadaver. And what's really incredible is you can actually grow these structures like a heart to the size of a human being, and you can step into it and look around. So things like the mitral valve, things like the tricuspid valve, things like the hip joint are now seen in ways that were never possible to be seen in the past, thanks to this kind of technology that allows us this amazing ability to visualize things. That was our new medical school building that you just saw, our health education campus, which now teaches medical students, dental students, and nursing students all under the same roof. Why? Because we deliver healthcare as a team, not as individuals. So our view is if we're going to deliver healthcare as a team, we should all train and learn as a team. We can go ahead and go to the next slide, please. Watson Health has been hard at work at looking at cognitive technology to help power diagnosis, also to collate and take these diagnoses and infuse risk and severity adjustments. But keep in mind, this is not foolproof, and we saw that. We saw that there have been challenges in the past by using artificial intelligence and predictive modeling when it hasn't worked out right. So it's always important, especially now, as we start breaking new ground on how we deliver on this new promise of artificial intelligence, to make sure that we truly are delivering on an equation which improves the quality and decreases the cost. Next slide, please. The whole idea of remote patient monitoring is something that is really interesting to me. As we start thinking more about taking care of populations, historically, most of us in healthcare wait for patients to get sick. We see them, we make them better. The whole idea of encouraging wellness or well-being for people to live healthier lives, eat healthier, to be able to use remote tracking technologies to do this is a huge opportunity to move in the future. So what do I mean by that? The congestive heart failure patient who gets on a scale every day, if we can see that that's on that scale, that they've gained 2 pounds, we know that they need to increase their Lasix and diuresis because they're going into failure. The patient that has now a continuous glucose monitor in their arm, if I can track that remotely and I can see that their glucose is jumping up and they're at risk, a simple phone call or a text message to say, give yourself 4 units of insulin. That type of treatment allows us to provide higher quality care at a much lower cost. So these are the areas where we're going, and eventually that should all be automated. It will not require a human being to make that assessment and make that phone call. It will utilize an artificial intelligence methodology to do that. Next slide, please. This is what we're seeing today already in diabetes, just in terms of the tracking and the ability to use AI-enabled algorithms to determine what the best changes in diabetes management ought to be, simplifying it and allowing much tighter control. Next slide, please. And then finally, this whole idea of synchronous and asynchronous visits. So how many times would you like to see your doctor and your doctor's not available to see you, right? Wouldn't it be great if you can get online, record your question, let them do a virtual examination, the doctor looks at it later and sends you the results and what they're suggesting that you do. So again, these types of enabling technologies will take us to the next level. Next slide, please. Circadia's IT bra. This is a wearable vest that's going to be used to screen for the detection of breast cancer at early stages. Again, using AI-enabled technology to recognize, is this a new lump? If it's a new lump, is it a dangerous lump? Is it firm? Is it soft? Is it movable? These types of things that all go into play that we as human beings can examine and feel and think about, that eventually using cognitive reasoning, AI will be able to do. These are the types of technologies that are very exciting. Looking at patient heart irregularities, being able to predict which patients that have a history of epilepsy are about to have a seizure and intervening before the seizure occurs based on an EEG tracing. These are things where AI will be able to take what a human being does today and spends thousands of hours doing And we'll be able to do it literally in seconds to make those predictions. Next slide. Google's DeepMind, being able to take huge amounts of data and predict serious health outcomes. Right now, using machine learnings and system neuroscience, but eventually getting to the point of cognitive reasoning where the brain, the mind, and the machine all come together to be able to make sure that our patients have access to the best care. Next slide, please. This is a pretty neat video. So, again, as human beings, it has taken us tens of thousands of years to learn how to walk. I'm an orthopedic surgeon, so I think about walking every day. Google created this paradigm where it made this stick figure teach itself how to walk. It learned how to walk literally in minutes. Now, you can see that over time, it continues to get better and better at the walking. It even has figured out that you can put specific forces against it and watch how it reacts to those forces. That's the idea of recognizing its surroundings and reacting to its surroundings. Now, who knows, maybe 10,000 years from now, when we walk, we'll be waving our arms around in the air as well. Maybe it's just further advanced than we are. I hope not. It looks like a goofy way to walk. But here you can get a sense here, even just running over rough terrain. All of these methodologies to improve gait. These kinds of technologies can help us as an orthopedic surgeon, right? If we have a patient with an amputation, if we have a patient that has severe arthritis, taking that information, that gait pattern, programming it, and looking to see if we can improve their gait patterns through changing the way they walk to decrease their risk of falling, decreasing the risk of further injury. These will be things that can help advance our healthcare. Next slide, please. DeepMind using super accurate speech recognition, again, to improve access, because one provider can then see more patients if they don't have to stop and type in their notes. The voice generation, the DeepMind and Google Lens and visual search to allow us, again, to be able to look from a pathology perspective or from an imaging perspective to say, does this mass look like a mass that is cancerous, or does it not look cancerous? These are the types of things that we will be able to do more and more of. Next slide. You can go ahead to the next slide. And then finally, I think detection and prevention, so risk scoring for specific diseases. You know, it's interesting today that when we look at many of our statistics around things like cancer, the statistics are based on huge volumes of patients. They're not based on individual patients. So if you're given a diagnosis, you really want to know, what is your risk? What is your survivorship at 5 years, 10 years, 15 years? Not necessarily what is the survivorship of all comers in a population. So if you're 25 years old diagnosed with a specific cancer versus being 70 years old diagnosed with that same cancer, it may very well be that the survivorship is dramatically different. And then factoring in there things like stage, things like class, things like type of cells involved, what kind of metastases are there, or are there not metastases. The more data that we have today overwhelms our ability to make predictions. AI will help solve that. Next slide. Today, Google can read mammograms, can read chest x-rays, can read thousands of these within seconds, allowing radiologists to concentrate on only the most complex cases because they don't yet have the cognitive reasoning ability, but the doctors do. So if we can utilize things like Google to go through thousands and thousands of normal films so we don't have to, and then it just pulls out the highest risk films for the doctor, that's a great advance for us. Next slide. Improving patient flow. Again, the whole idea of using AI to help better manage the resources that we have. Things like managing length of stay, operating room time, staffing models to bring out costs, take out costs out of healthcare. Next slide. And then in the future, where we're going. Next slide, please. This simple slide gives an idea of just some of the things that we're working on today, whether it's surveillance tools, digital avatars. A study just came out that looked at children with autism. You might ask yourself, you know, will we really ever be comfortable not talking directly to the doctor or directly to the nurse. As it turns out, children with autism respond much better to an avatar than to a human being. So if we put avatars in front of them and we work with them on communication skills, they actually will communicate more quickly than they will working with a speech therapist, a psychologist, or a doctor. So we also have to expand our horizons in recognizing that there are many areas where AI will really further our advances much more quickly than we might even recognize. Next slide, please. And then finally, again, you heard a little bit from Amjad about this in terms of this explosion of investment. So in the United States alone, we've seen an 11x increase in the investments in the AI world from 2014 to 2021. Globally, next slide, please. That number is growing at a 56% increase every year. So absolutely amazing. And you can see that a lot of that growth is outside of the United States, and a big chunk of it is in the Middle East. So again, to Amjad's point, Jordan is really beautifully positioned to play a lead role in this area. Next slide. By the year 2023, the global AI healthcare market is expected to reach $22.7 billion. That is incredible, considering that 10 years ago it was zero. That's an amazing opportunity for us globally. Next slide. So just my final takeaways from the presentation. We clearly do have a global healthcare crisis today, and I think AI is an opportunity to be a huge part of the solution to that. In fact, if we don't utilize AI, we will not solve the problem. The problem is growing faster than the solutions. That's the reality. So without AI, we'll never get to our end game. Our true north, just remember, is value, quality, and access divided by cost. That eventually, as we get better and better at cognitive reasoning, we'll be able to kind of outgrow this machine learning and machine learning-based predictive modeling. And we will continue to see an exponential increase in terms of AI in healthcare. Thank you very much.